Welcome everybody to our annual company training and reopening procedures. Before we begin today's meeting, I just want to remind you to use the chat box to ask your questions. We'll have somebody monitoring that throughout today's meeting. I'm going to start by sharing my screen. So if you just give me 1 second. I'm going to put the sound on because we will have some videos. All right. I hope everybody can see this. It should say emergency preparedness. Emergency preparedness plan. And we're going to begin with both myself and Kiana. And the overview of this section includes a communications phone tree, visitor policy, our check-in policy when you come to the Adult Day Health Center or to the office, the reopening protocols that we are doing as a company, our participant tiers that we've selected, our COVID-19 emergency guidelines, navigating the COVID-19 response sheet, some information from the CDC and NIMH guidelines on trauma, and then AERs. So we'll begin with our communications phone tree. And as you see here, whenever we have either a COVID incident or any type of emergency, we do have a phone tree depending on the location. So at the top, you'll see Jasmine Era and Irene Cullen. Jasmine is overseeing our phone tree for the Kalihi location, and Irene is overseeing our phone tree for our Pearl City location. So they will begin by calling the first names on the list, which are our service supervisors, Glory, Mila, and Sunday. And then they will continue by calling the caregivers or the guardians for each one of our participants. Once they're done contacting these caregivers, guardians, giving them an update of what's going on, what the company's plans are, they will report back to Jasmine or Irene. And Irene and Jasmine will then report back to John Caravona or Esperanza, who are our executive director and assistant executive director. If at any time there are needs for EMS or 911 to be called, that will also be done during this. This next thing we're going to talk about is our visitor policy. Due to the COVID-19 pandemic, we are requesting that anybody who comes to the office does not come unannounced. That means we're requesting that at least 10 minutes prior to your visit, you need to call and let us know. When you call to let us know, we will ensure that nobody else is visiting at the same time and that we will be able to take you in. So to prepare you for this, we want to let you know that there will be a temperature check taken, a questionnaire of a few questions will be given. We'll have you sign in. We will have you wash your hands, and then we will walk you to a designated area. In order for you to understand what is going on, we do have a video that we'd like to share with you so that you can experience virtually what to expect.
I'm gonna ask you several questions.
Okay.
Have you ever experienced any of the following symptoms in the past 48 hours? Fever, chills, coughing, short of breath, or difficult breathing, fatigue, muscle, body aches, headaches, new loss of taste and smell, sore throat, congestion, runny nose, nausea, vomiting, or diarrhea? Yes or no?
No.
Within the past 14 days, have you been in close contact with a person who is known to have laboratory confirmed COVID-19 or with anyone who has any symptoms consistent with COVID-19? Yes or no?
No.
Are you isolating or quarantined because you may have been exposed to a person with COVID-19 or are worried that you may be sick with COVID-19? Yes or no?
No.
Are you currently waiting on results of a COVID-19 test? Yes or no?
No.
If you answer no to all of the questions, then I may let you in. I'm going to take your temperature. You have 90 Can you please log in?
Yes.
Thank you.
You're welcome.
And may you go wash your hands.
Yes.
Turn on the water. Rinse with soap and water for 20 seconds.
Don't forget your ales nay. Oh.
Grab a paper towel, wipe, dry, and turn off and discard. And then please have a seat at the table. Thank you.
You're welcome. So that's what you're going to expect when you come into either of our adult day health programs or to visit somebody here in the office. Now I'd like you to pause this video and write down the 3 steps that you remember that we need to take when coming to the office. You may restart the video once you are done. The next thing I want to do is just give you a basic overview of everything that's happening today. We are required to train our employees and our clients and administrative staff and our families. And so this is part of what is going on today. We want you guys to know about how to identify the different signage that we have up in the locations, how to stay 6 feet away and how to recognize that you're 6 feet away from the next person, and show you that we are creating seating charts for where people are. And that's why as a visitor to the office, we will need to know ahead of time so that we can plan the appropriate space and visit when you come. Our next section that I want to share with you is our participant tiers. And this is for our adult day health programs. So if you're an employee that works outside of the adult day health program, this doesn't affect you as much, but it's good to know. So we've taken all the names of the clients and we've put them into 3 different tiers of phasing back into our adult day health program, depending on their needs, depending on their skill sets, and depending on their health issues. So somebody with a tier 1 phase back in may be able to put a mask on for the next 6 hours, be able to follow directions, stay still in one location, good health and hygiene, and are ready to come back to adult day health program. Versus somebody in a level 3 tier phase in, they may be a little older, they may have higher risks, and so we may want to make sure that the COVID-19 pandemic has lessened or is not a high risk to them for them to come back. If you have any questions on these tiers, ask your service supervisors. If not, just know that this is just an idea. This is a starting point for us. People who fit in a tier 1 may not come back until, or may not be ready to come back until a tier 3 or a tier 2, but this is an idea of how it will look like. I'd like to now turn the time over to Kiana, who is going to go over our COVID-19 emergency guidelines.
All right, so today I'm going to be covering the COVID-19 emergency guidelines, also navigating the COVID-19 response sheet. So that's going to be page 13 of the emergency procedures manual. So if somebody is showing symptoms, it's fine to just go directly into the manual. You can rip out the page. It's got all the questions there in front of you, and you can write in your answers. We can just replace it later. Next slide. There we go. So step one, you're going to immediately separate the individual from the rest of the group. Next slide. You're going to answer the 3 W's. So the first W, next slide, is why. So why do we suspect infection? So what's their temperature? Did they answer yes to any of the pre-screening questions? Are they showing any physical signs of symptoms? And is there anything else that's not covered that might indicate infection? So it could just be if they said that they felt sick, they told you. Next slide. Next one is when. So this one's pretty easy. Just note down the date, the time, and the location. Next slide. Who. So who has been in contact with this person? Who in the workplace has been within 6 feet of the individual? Who may have been near this person for more than 15 minutes? Who was in the facility at the same time as this person for the past 2 days? And lastly, when was the last sanitization in relationship to the onset of symptoms? So to further kind of explain this part, the ADH is going to be separated into different sections, and each section every 15 minutes will be sanitized, especially the high touch areas. So wherever this individual began to have these symptoms in that section of the ADH, when was the last time it was sanitized? Next slide. All right, notification protocol. This is basically what Helen described earlier as the phone tree. So quickly, notify Jasmine or Irene if it's in the ADH. So Jasmine is in Kalihi, or Irene if this is in Pearl City. If you aren't working in the ADH and it's elsewhere, then you would notify your service supervisor and they would commence the phone tree. So they're gonna go ahead and notify RN supervisor is going to contact the case managers, the guardians of the participants and their families, and let them know to pick up their participants, reporting back to Jasmine or Irene when all that's completed. Contact emergency services if it's necessary. And then lastly, let the executive director or SB and assistant executive director or John know. Next slide. All right, so worker and participant responsibilities. You're gonna go straight home. Just stay in your little personal bubble and avoid contact with anybody else. Call your doctor for further instructions and more information about testing. Contact your supervisor or the company to discuss options of working from home or possible leave of absence. And you must have a medical evaluation and approval to return to work after this. Next slide. So if you have any chronic medical conditions that cause COVID-19-like symptoms, you're also going to have that cleared by your doctor to return to work. And if you've been in close contact with someone who's tested positive for COVID-19, you're also going to quarantine for 2 weeks. Next slide. All right, so this section is on cleaning and disinfection after a person with COVID-19 has been in the worksite. So cleaning and disinfection, it's going to be covered a little bit more thoroughly by Jasmine and Bubbles later, but just an overview of after we've cleared the ADH. So we're going to close off areas visited by the ill person, open all the doors and the windows, and use fans to ventilate and air out the area. Wait 24 hours or as long as practical before beginning cleaning. The cleaning staff should clean and disinfect all areas used by the ill person, especially the frequently touched areas, wearing disposable gloves, disposable gowns while cleaning or handling the trash. If disposable gowns aren't available, you can also just wear coveralls, aprons, or work uniforms that can be worn and then washed on high heat in the laundry afterwards. You're also going to wash your hands after removing gloves or handling dirty laundry. If it's been more than a week since the person with suspected infection has been in the facility, additional cleaning isn't necessary simply because the virus doesn't survive in those conditions that long. Next slide. All right, so this next section is the CDC, or Centers for Disease Control and Prevention, and NIM, or National Institute of Mental Health Guidelines to Trauma. So nobody in the company is expected to be an expert on the subject. It's just something to look out for developing within ourselves, or if you see it in your participant. Studies show that it affects people with developmental disabilities in that community more intensely than others. So if you see these changes in your participant, it would be something to bring up to your service supervisor or as well as the case manager afterwards. A traumatic event is a shocking, scary, or dangerous experience that can affect someone emotionally and physically. So experiences like natural disasters, so hurricanes, earthquakes, a pandemic, acts of violence such as assault, abuse, mass shootings, as well as car crashes or other accidents can all be traumatic. Next slide. So responses to trauma can be immediate or delayed, brief, or prolonged. Most people have very intense responses immediately afterwards, often for several weeks, months after the event. These responses can include feeling anxious, sad, or angry, difficulty concentrating and sleeping, continually thinking about or bringing up what happened. For most people, it's very normal and an expected response, and it lessens over time and gets better. In some cases, these responses continue for a longer period of time and interfere with everyday life. So if they are beginning to interfere with life and aren't getting better over time, it's important to seek professional help. Next slide. So some signs that an individual may need help. That would include worrying a lot, feeling anxious, sad, or fearful all the time, crying often or suddenly, having trouble thinking clearly, having frightening thoughts, flashbacks, reliving the experience, feeling angry, resentful, or really irritable, nightmares, difficulty sleeping or interrupted sleep, avoiding the places or people that bring back disturbing memories and responses, and becoming more isolated from family and friends. Next slide. All right, so some physical responses to trauma may also mean that an individual needs help. Physical symptoms may include headaches, stomach pain, or digestive issues, feeling really tired, more so than normal, racing heart, sweating, and being very jumpy or easily startled. Individuals who have a mental health condition or who have had traumatic experiences in the past, who currently face ongoing stress and lack support from friends and family may be more likely to develop more severe symptoms and need additional help. So some people begin to self-medicate. They might turn to alcohol or other drugs to cope with their symptoms. And although substance use may initially seem as if it's relieving your symptoms, it just can lead to new problems and get in the way of any sort of recovery. So next slide. Some healthy ways of coping during this time period include avoiding self-medicating, so no alcohol or drugs, spend time with loved ones and trusted friends who are supportive. Now, I mean, maybe texting or a phone call or a video conference like we're doing now would be best. and also try to maintain a somewhat normal routine for meals, exercise, and sleeping. Next slide. So finding help if you know someone in crisis. Mental health conditions can be treated. So if you, someone you know, or even a participant needs help, you're gonna go ahead and talk to, if it's you, your healthcare provider, so your doctor, or notify the service supervisor if it's a client. There's a couple of links I have up here. The first one is just tips for talking with your doctor. So just starting out. Second one is where to start if you need to find a good doctor. It's got a bunch of links for finding one that's not just good for you or a good fit, but also might be more affordable or sliding scale. There's also a text hotline I have up there where you don't even have to speak to anybody or be face-to-face with someone to see the next steps on how to get help. And then it also has, let's see, the National Suicide Prevention Lifeline. So if you're really in a crisis, you can just call them. All right, so next slide. That is it for the entire section on trauma. And I'm just going to touch on an AER update and then let Sunday take it from there. Update. It's on adverse event report, so AERs, for specifically change in health condition requiring medical treatment. So an AER must be generated and submitted to the Developmental Disabilities Division, or DDD, under the category of change in health condition requiring medical treatment for the following COVID-19 related incidents. If the participant has had direct contact with a person who has tested positive for COVID, if the participant was tested for COVID, and if they were tested and it came back positive. The next one is also if the incident was related to COVID-19 and didn't require medical treatment, as defined in the DDD adverse event policy and waiver provider standards, it still must be reported as an adverse event. So an example would be if the participant was tested and then they went home to quarantine until they knew the results, that would still be required to be written as an AER report. So, yes. Oh yeah, so this one is different. It has to be submitted to the DDD within 24 hours rather than 72. Okay, Sunday, if you wanna take it from here.
Okay, all right. Since I'm at, thank you very much. Thanks, Helen. Okay, so we're gonna go over AERs. And Kiana did add in, because of COVID, that we would be doing 24 hours notification. So an AER has to be submitted within 72 hours to case management. But it also has to be, they have to be notified verbally within 24 hours. So what I want to do is I want to go over this entire AER with you, where things are, what needs to be done, so that we just get a refresher. So the first thing is the waiver participant or a non-waiver. All the participants that we work with currently are waiver. So you would check waiver. The event occurred during billable service. It has to. You shouldn't be with your participant after billable service hours. So that would be yes. The event date, make sure that you fill it out exactly how they ask, yeah? 2 numbers for the month, 2 for the day, and then for the year. Event time, the participant's name, go last name, right? Last name, first name, middle initial, if there is one, their birth date, their sex, and then their Medicaid number. So their Medicaid ID can be found on their vital information sheet in their binder, yeah, in their chart. So can their case management unit, number 7, you would fill that in. The reporter's name, number 8, that's your name. Your relationship is going to be DSW, okay? The island,
whether you're on Oahu or Maui. Telephone number, that's not going to be your cell number, that's the office number. So you put the office number, ACS's office number, and their fax number here. And then the agency, we need to fill it out. Don't put ACS, don't put shorten it, put acronyms, fill out the entire company name here. So for the adverse event information section, okay, so the event location, where did this happen? Was it at the program site? Was it at their home? Was it in the community? Where did it happen? If it's other, check other and be very specific where that is, okay? The persons that were present, obviously agency staff, if you were there, okay, the participant, and anyone else, including other participants if they were present during the event, okay? And then who was notified? You should always have that you notified your service supervisor, that sometimes, you know, if you notified the executive director, the assistant executive director, whoever you notified, you need to put their name here. And you also need to put the date and the time that you notified them. Very important. These reports go on a time frame basis. So they want to know how quickly we reported things, who we reported them to. And they do that by this recordation of it over here. And then what was done? Did the participant need any kind of treatment, right? Did they need anything? If they did, you put down the date and the time and where they received treatment, okay? Now, for me, the most important part is going to be the next section, okay? And you need to be able to put down for section 18, the discovery, you want to be able to put everything that happened. So always think of this as a who, what, why, when, where, and how, okay? And be as specific as possible. Because this section is so small on the AER sheet, I always suggest that we add another page to it. The more that you write, the better it's going to be. So be very, very specific and very thorough when you're writing this down. Okay. Can I get the next slide? Thanks, Helen. Okay. So the next part now is we're going to look at basically the nature. What was the nature of the AER? So we'll go through each one of these and you're going to check whichever one is appropriate. So was it suspected abuse, neglect? And neglect also is financial exploitation. It does happen, okay? And you would check that. If you have a question, whether this is financial exploitation or whether it is suspected abuse, please call your service supervisor. If we're not available, please contact the executive directors, yeah, and ask them, ask the office. You can call, but you need to call to find out if you're not sure. Did they receive an injury from an unknown or known cause requiring medical treatment? Then you would check the type of injury that was received. Where was it on location as to their body? And of course, this copy doesn't show it. There's half brother's head right there, but on your actual AER sheet, there is a front and a back body portion that we need to be able to check where that injury is, okay? And then what the cause is. If you don't know how they got that, let's say that give you an example. Let's say that you pick up a participant and you're gonna be taking them out on CLSI. When you pick them up, they've got a gash on their knee. You're gonna check with the caregiver, whether that be the caregiver, whether that's parents or whomever that might be, and ask what happened, all right? You need to notate that down on your AER, okay? And you do need to do an AER for that. If it was a medication error or an unexpected reaction to medication or some kind of treatment, that needs to be notated appropriately. A change in the participant's behavior. Now, this one, it says requires a new or updated behavior support plan. If your participant has a behavior support plan on file and you're going according to that and you notice that they have a new behavior that's not in their chart, it's not on their plan, you need to mark it down in this section and that would be considered to generate an AER. If you see a change in behavior, maybe you know, they have a certain behavior that you're looking out for, but all of a sudden you see a change, you see something else occur, you need to log it down here. If it's a new behavior, but if you have somebody that has a very typical behavior that is notated in their ISP, they have a positive behavior support plan, then you don't notate it in the AER. It's only a change or something new. The next area would be a change in a participant's health condition that required medical treatment. A lot of times our participants can't tell you if they are having chest pain or they're having some type of pain. So if you notice, maybe they're holding their chest or they're having a hard time breathing, that would dictate something that you would put in this section. Notice it also has seizures. If you have a participant that is prone to seizures, and any participant that has a seizure has seizure protocols. If it's a normal seizure within parameters of their actual plan, you don't need to notate it on an AER. But if it becomes outside of that, you have to call the hospital, you have to call 911. Then you would need to dictate that in this section. The next area is death. Anytime a participant passes away, this section needs to be filled out. And last slide, I believe. Oh, and the last part on here, which you can't see, is the participants. If you don't know where your participant is, that would also dictate filling out an AER, okay? Okay, and the last slide, thank you, Helen, is the use of, let me see, do we have one more slide, Helen? Okay, use of any restraints. No participant that we have that I'm aware of has any kind of restraint protocol authorized in any of their charts. So this is not anything you would ever check. Use of seclusion, we don't do seclusion, it's not authorized, so we wouldn't be checking that. Or any kind of restricted intervention or procedure. Any one of these actually has to be approved by DD themselves, and it has to be very specific in their plan or in their ISP, and you would be trained on it. So you'll know if they have it or not. And I can at least say with assurance at this time, there is no participants that we have for this. The last section, section 20, the remediation of action. You do not need to fill that out. That is for your service supervisor to fill out. And then you would sign the form down here and put the date. And that's all I have for AERs. I'm going to turn it over to Helen. Thank you.
Thank you, Sunday, for all of that. Thank you, Kiana, for your portion also. The next section that we'll be going into will be transportation guidelines and vehicle checklist. We're going to show you a video, and what we would like you to do is take notes on this video. There are 4 steps to it. You will be asked to answer a few questions at the end.
Are you ready? Let's go.
Sorry, let's try that one more time.
Come guys, come in and see.
You guys can see. You're fine. Okay.
Body ache, headache, loss of smell, appetite, sore throat, congestion or runny nose, vomiting or nausea, diarrhea. No. Can I take a temperature, Kat? Maybe 7.8. Slow down. home, hand sanitizer. Rub your hands together. Okay, good job, guys. Come in the van. Go to the back and buckle up, okay? Oh, you can do it right there. Buckle up. Okay, good job, Bronson.
So while you're watching this video, I just wanted to let you know that we as an agency have also created a checklist that has been placed in each one of the company vehicles. This checklist just helps to make sure that we are disinfecting our vehicle and the locations. The checklist itself will and should match the log for the vehicles. If you are using your own personal vehicle on company time, you are welcome to come and get a copy of this checklist. Also, talk to your service supervisors if there are disinfectant or supplies, PPE that you need for your vehicles. Please let them know so that we can get those supplies to you. Now, before we finish off with this section, I want you to take note of these questions. First of all, what steps do we use to ensure a safe vehicle? So along with the questions that we asked you earlier, take a moment to write your answer for this. Second, what questions were asked prior to entry to the vehicle? Next, what PPE or personal protective equipment were used in this situation? And finally, what supplies do we need to make sure are in our vans? And this also, start thinking about your own vehicles. What supplies do we need to make sure that you have when you are out with your clients so you can continue to be safe? So I'm going to stop sharing on my screen right now. And I'd like to turn the time over to Jasmine, and she will continue with more of our safety protocols.
Hello there, everyone. Helen, can you enable share screen?
Is it going through?
Yes.
Awesome.
All right, we will be talking about preventing the spread of infection and social distancing. Our infection control protocols are, we will be taking temperatures and questionnaire screening before entering the center. After you take your temperature and questionnaires, then you will walk over and you wash your hands at the sink area. Wash your hands 20 seconds upon arrival. If soap and water are not available, alcohol-based and hand sanitizers that contain at least 60 to 95% alcohol may be used. If anyone is showing signs and symptoms, they will be held in our quarantine room until they are picked up by family, caregivers, or guardians. We ask all families, guardians, and caregivers to take temperature and complete questionnaires before departing. Here's a video on the steps of hand washing.
Jasmine, there's no sound. Can you stop share and make sure you've clicked on the sound and then start share again?
share computer side.
What is it?
And your friend lost there. Ask it right if you lost there.
Can you guys hear?
No. So when you stop share again, and when you click on share screen, there should be 2 boxes on the bottom of your screen for audio before
Okay.
you click share. Thank you.
So for our sanitization protocol, we'll be using 70% isopropyl alcohol to spray down any high-touch areas every 15 minutes. We will also keep a log of every time we do our sanitization. And for our disinfecting times, it'll be twice a day before we open and when we close. And here's another video of sanitization at.
The CDC says cleaning and disinfecting surfaces is key when it comes to preventing the spread of COVID-19 or the coronavirus.
But how do we do that properly? I looked at what the Centers for Disease Control says we should be doing. Now, for some of you, this may be just a reminder, but for others, this could be surprising.
A big part of staying healthy is cleaning and disinfecting frequently touched areas. The CDC says it can reduce the risk of being exposed to things like the flu or coronavirus.
But there's a difference between cleaning and disinfecting.
Cleaning removes germs and dirt, so do that first. Disinfecting kills germs on surfaces or objects, so do that second. But make sure to use an EPA-registered disinfectant like this Lysol disinfectant spray. The Environmental Protection Agency says it may be effective against the coronavirus, but can't guarantee it. It's also important to read the instructions for the product to be effective. This one says to wipe the surface long enough for it to stay wet for 4 minutes. At work, the CDC suggests using a disinfectant to wipe down surfaces like doorknobs, keyboards, desks, and phones daily. At home, don't forget about other common areas like light switches, handles, and sinks.
One tip, remote controls can be hard to clean because of all these crevices. An easy fix, put it inside a sealed plastic bag and just wipe that down.
But the most important step, wash your hands thoroughly and often.
That means washing your hands for 20 seconds or singing happy birthday twice. And when you're done, use the paper towel to turn off the faucet and open the door. Now, you may be asking, why do we need to wipe down all of those things? But like the doctor just mentioned in our interview, if you think about it, we touch the surface, we don't know who touched it before us, and then of course we touch our face.
You know, Dr. T mentioned not to touch your face. I realize I touch my face
Constantly.
very, very often.
Yeah.
Oh, man. Think about this. We'll have a link to all those tips and steps from the CDC on our website. That's k2n2.com.
Hi. Nice to meet you.
And here we're going to learn how to use, to do the proper use of PPEs or personal protective equipment.
How to safely put on personal protective equipment, or more commonly called PPE. We will demonstrate one way to appropriately put on or don PPE. More than one donning method may be acceptable to your facility. It's important that you receive training, demonstrate competency, and practice your healthcare facility's donning procedure. First, identify and gather the proper PPE to don, including an appropriately fitted isolation gown, a NIOSH-approved N95 filtering facepiece respirator or higher level respiratory protection, or if a respirator is not available, a face mask, a face shield or goggles, and a pair of disposable patient examination gloves. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Put on the isolation gown. Tie all ties or snap all snaps. You may need assistance from another healthcare provider. Put on the N95 respirator. When using a respirator with a nose piece, fit it to your nose using both hands. Do not bend or tent the respirator. Extend the respirator under your chin, protecting both your mouth and nose. Pull the top strap over your head, placing it on the crown. Then pull the bottom strap over your head, placing it at the base of your neck. Lastly, perform a user seal check. Do this by using your hands to cover the surface of the respirator and gently exhale, checking that the facepiece bulges slightly. Then, while keeping your hands over the respirator, take in a quick, deep breath, checking that the facepiece collapses slightly. If air escapes through the edges, readjust the fit of your respirator and perform another user seal check. Do this each time you put the respirator on. If a respirator is not available, put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Next, put on a face shield or goggles. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. You are now ready to enter the patient's room. How to safely take off personal protective equipment, more commonly called PPE. We will demonstrate one way to appropriately take off or doff PPE. More than one doffing method may be acceptable to your facility. It's important that you receive training, demonstrate competency in removing your PPE without contaminating yourself, and practice your healthcare facility's doffing procedure. Remove and discard your gloves. Gloves can be removed using more than one technique. For the glove and glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With the beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding a forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. Dispose of the used gown. You may now exit the patient's room. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again perform hand hygiene after removing the respirator or face mask. You have now completed the doffing procedure.
All right, and our last slide talks about social distancing, staying 6 feet apart, placing place cards on the floor for participants to understand that they are 6 feet apart from one another. And here's another video.
We hear the phrase social distancing a lot these days with the spread of the new coronavirus, and you may be wondering, how does it help? When a person with the coronavirus coughs or sneezes, they spread the virus through droplets from their nose and mouth. It's thought that these droplets can remain in the air for a few hours and also land on other people and surfaces. You primarily catch the virus by breathing in these droplets or by touching a surface that has the virus on it, and then touching your mouth or nose. Social distancing helps slow down the spread. That means you avoid shaking hands, avoid gathering in groups, stay away from surfaces many people touch, and keep your distance from people outside of your household. A 6-foot distance is recommended. Why is this important? Our healthcare system can only handle a certain number of sick patients at one time. That's this flat line, the capacity of the U.S. health system. The red curve shows what will happen if we don't do anything. This infection will quickly spread to a lot of people. Our hospitals won't be able to care for so many sick patients at once. They won't be able to keep up. With social distancing and good hygiene, we can help slow down the spread of the disease and reduce the number of people who get sick. This gives our hospitals a fighting chance of taking care of everyone who needs it. That's the blue curve. That's what we mean by flattening the curve. We slow down the spread of the disease and we save lives. One of the most effective ways to flatten this curve is to practice social distancing. So what does this mean for your everyday life? Some of the ways in which we connect with family and friends will have to be put on hold for now, like parties, lunch dates, group classes, or play dates for our kids. Don't share objects such as toys, handshakes, or hug anyone outside of your household. You may think it's okay to connect with just that one friend, but it can take up to 2 weeks for symptoms of the coronavirus to show, so it can spread before you even realize you have it. That's how just that one connection can continue to spread the coronavirus and make the need for social distancing last even longer. But there are things you can do. Embrace technology. Connect online with friends and family through video calls, texting, and social media. Go for a walk or run. Work in your garden, workshop, or kitchen. Knock off things on your to-do list. Try a podcast, read a book, try a new hobby. Enjoy some family time. If you do need to leave your home, try and limit the time you spend in public spaces like the grocery store. And keep a 6-foot distance between you and non-family members. Humans are naturally social, and social distancing may seem unnatural at first, but it's important. Finding new ways to stay connected from a distance will give us all a chance to stop the spread of the coronavirus.
All right, that was the end of our slides. If you have any questions, feel free to ask. Thank you very much. I'm turning it over to Helen.
Thank you, Jasmine, and thank you for participating in our training today, everybody. So before we end the training, I just would like you to stop the video one more time, or once you stop this video, just give us some feedback. What did you learn about hand washing, putting on and taking off the PPE? And then what are some ways that you are doing to social distance, especially if you're working with a participant right now? How are the two of you staying safe while you are working with them? Once you have turned in your questions and your answers to us, I will then forward you a link where you can sign that you have completed today's training. If you have any questions, again, please contact the office at 848-2779. Aloha, and thanks for joining us today. Okay, stop recording. We're done. You want, yeah.